So today we're going to talk about the cervical spine and the neck and how to protect your neck. There are just a couple basic tips that will help immeasurably in protecting your neck. Hello, my name is Jeff Petersen. I'm a physical therapist with Petersen Physical Therapy, and we've been doing a series of videos on joint protection. And in the earlier videos, I talked about some of the forces that are applied to joints and some of the tissue that's involved. So I'd encourage you to watch those. I hope these are helpful. If they are, please send me your comments. If you have other ideas for videos, send me those comments. But smash the emojis so that you can give us some love and we know that what we're doing is helpful. Neck pain, neck dysfunction, headaches are really common. They can be really challenging. The principles all apply. The most important thing is posture. And if you look at our skeleton here, it has a plumb line looking on the lateral view here. And you can see that the plumb line normally passes right in front of the cervical spine, and then a little bit more in front of the thoracic spine because there's an outward curve. There's a general inward curve of the neck. That's the lordosis, a little bit of kyphosis and a little bit of lordosis. That's kind of the ideal posture. Very few of us have ideal posture, and that's the whole discussion, function versus structure, and how are we structured, and do we want to force normal posture or not? And I'm not going to talk about that today, but I do want to talk about there are ways you can improve your posture and minimize the stress on your neck. Now, we talked about in the last video about shoulder, the whole idea of the leverage. So I'm going to show you with this hand. So if I've got a weight here, let's say this is my head and I'm in good posture. So all the joints and the muscles are supporting my head. As I start to come forward with my head, it's like this ball going forward. If this were a 10-pound ball, I would only be able to hold this for so long with it out here because of the lengthening the resistance arm compared to the axis of motion. That's the principle that happens when your head comes forward. The other thing that happens, and I want to show you these joints, is, and this guy lost his head, and he's got a sublux of C1. Okay. So the head sits here, gentle inward curve of the cervical spine, gentle outward curve of the thoracic spine. If you look closely, you see there are little joints that are here, where one vertebra articulates with the other one, and they're planar joints, and so they're susceptible to that compression. You also see there are nerve roots that come out. These come out and they join, and then they separate and they join, and ultimately become the median nerve, the radial nerve, the ulnar nerve in the hand. What can happen is as you get that forward head, you compress these joints and you create oftentimes hypermobility. That hypermobility can create spurs. Those spurs can then irritate those nerve roots. You start to get that tingling down into the hand and arm. Or it can just create enough stress that you're getting tight in the front of your neck. So the most important thing, along with the other principles that we talked about, maintaining good fitness, maintaining good nutrition, staying active, is the position of your head and neck throughout the day. It also involves the shoulders. So the ready position for any sport is up nice and tall, shoulder blades back, nice loose knees. Whether you're golfing, lifting weights, playing tennis, or playing pickleball, that's the position to start. What happens each day is we get in front of the computer and that head comes forward, the shoulders come forward. That'll tighten the muscles in the neck here. That'll stretch the muscles in the back and make them weak. So we want to make sure we maintain good posture. Another thing that's really important is breathing. So we see a lot of people that use their neck muscles to elevate their rib cage as opposed to their diaphragm to open up the lung, open up the thoracic cavity to allow air to rush in. So working on diaphragmatic breathing is an important thing to protect your neck. Watching your posture. We see people all the time playing with their phones, sitting at the computer, watching TV, lying down on your side watching TV when you're sleeping. If you have too much of a pillow, you're going to compress one side and stretch the other side. So those are all important. Lying, sleeping on your stomach where you have to rotate your head to compress one side and stretch the other side. All that stuff is going to create force on the neck. And once you start to have neck pain and headaches, it's really important to, your margin of error is now less than what it might be. You can go sit in bad posture all day long and maybe not have pain. You do that for 20 years, you're going to have some pain and dysfunction. So really watching your posture, staying strong, the muscles that attach from on your shoulder in your thoracic spine also go up to your neck. So making sure that your shoulder blades are nice and strong, your neck muscles are nice and strong, and your mobility is good while you're watching your posture. Posture, posture, posture is the number one thing. Whether you're sleeping, whether you're sitting at the computer, whether you're playing sports, you want to make sure you have good posture and your head is over your spine before you do anything. And then maintaining good flexibility, good strength, particularly of your shoulders, good nutrition so that you're healthy. All that stuff is going to affect your joints. That can also affect your headaches. The other thing that can happen is your jaw, the way you protect your jaw. We see people with that forward head. As soon as you get that forward head, you literally have an underbite because your jaw hangs on your skull. If you have tightness on one side, now you got a crossbite. So making sure you maintain good posture and good strength in your neck muscles is going to help your jaw muscles. Making sure that you're not chewing gum, you're not taking too big of a bite, and you're maintaining good health in your TMJ. But the TMJ can't, and your upper cervical spine, or where your head meets your spine, your skull meets your spine, they're all very related. So posture is really important for your TMJ as well. So staying strong, keeping those joints stable, maintaining your posture is really the key to protecting your neck. Then if you develop issues, that's when you want to see your physical therapist because the neck can be really complex.